आज रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है।
An armed soldier stationed at the border to safeguard his country has a faint idea about the enemy's whereabouts and information regarding the enemy attack, whereas in this case, we had no clue about the virus and how to deal with it. Despite a successful vaccination campaign in Europe, the continent is presently facing an overwhelming third wave infection of the coronavirus disease. The infection has particularly surged Scotland in the United Kingdom and France, bearing the highest number of positive cases. Presently, COVID-19 is surging across Africa, but less than 1% of the population is vaccinated. There's a great possibility that the ones previously infected severely and recovered may face the same plight again in the next wave. A few months ago, we didn't know what we were facing, but now we have the experience of the first and second wave. If the third wave is anything like the previous ones, we should be able to sail through it easily. The Delta and Delta Plus variant has been the most detected in the recent times, along with a new Lambda variant across Latin America since April 2021. The virus mutates in such a way that it deceives the body's immune response. The central and state governments have already initiated efforts by setting up COVID task forces to be medically prepared for the scenario predicted to arise in the next 6 to 8 weeks. The second wave of COVID-19 saw the increase in demand for medical oxygen and modular hospitals. Under the Project O2 for India, a national consortium of oxygen is enabling national level supply of critical raw materials such as zeolites in setting up small oxygen plants, manufacturing compressors, concentrators, and ventilators. An extension of hospitals' infrastructure has also been built, forming modular hospitals. The introduction of Covaxin and Covishield has also helped India to estimate a supply of 2 billion doses. Along with this, maintaining a good stock of life-saving drugs has been scaled up. Doctors and health workers are also being trained to identify cases that need extra attention to save time and human power. Vaccination in rural India remains a huge challenge. Behavioral dynamics of the population and myths regarding the after effects of vaccination, effects on fertility, effects on menstrual cycle in females are hovering high and dry. People in metros and cities are aware, but a larger section in the rural areas is influenced by factors including perception, trust, norms, and beliefs before they decide to take a shot. This challenge has to be mitigated through the setting up of robust vaccination mechanisms and awareness drives at rural levels. During these tough times, people must adapt to constraints in economic activities and stop overspending in case of a lockdown again. A minimum of 1 month's dry groceries must be stocked up at home to avoid moving out frequently. Fruits and vegetables also could be stocked up that can manage the show for a few days. People should strictly adhere to cost cutting measures with regard to food habits, whether cooked at home or ordered for home delivery. Apart from adhering to COVID protocols, only an assigned person from a family should visit his close by regular grocery store for purchases in a short span. Maintaining psychological balance also plays a major role in one's life to bear the situation, get through it, and also help others to get through it. Meditation, yoga, breathing exercises, playing indoor and board games, gardening, and indulging in kitchen activities will surely work towards the psychological benefit. People can also indulge in extracurricular hobbies like sketching, painting, playing musical instruments, and learning religious hymns to battle mood swings. Atmanirbhar, the term brought to the citizens of India during the first wave of the pandemic, stated the initiation of self-reliance among citizens to the maximum with regard to situations that could be dealt without the involvement of the government. The government has and will always be there for its citizens. No government throughout the world was prepared to take this battle head on, and this has run for more than 15 months now. Such a long period should be sufficient enough to navigate through the third wave cautiously. All of us need to give our best to keep this disastrous situation at a lower scale as much as possible after we observed a 4-time rise in the second wave. Scary enough to not even be able to imagine what the third wave may lead to. The government can help its citizens only if the citizens in turn cooperate to strictly adhere to COVID protocols. Vaccination is not a cure to this disease, but is only an immunity booster dose. If people continue to take strong measures, it's possible that this time the fresh wave will be managed more efficiently. On a positive note, I firmly believe that the third wave is likely to be well handled by the government, relevant health authorities, and the citizens.